Your doctor says intermittent fasting is dangerous after 65. Your neighbor says it's the best thing she's done for her health in 20 years. Both can't be right. So what's really happening when seniors skip breakfast?
If you're feeling overwhelmed by conflicting advice about intermittent fasting, you're not alone. One day you read that fasting will help you live longer and lose weight. The next day, your doctor warns you it could be dangerous at your age. Your friend swears it gave her more energy than she's had in years, but your neighbor says it made him feel weak and dizzy. Meanwhile, the internet is full of 20-somethings preaching about fasting benefits. But what about us? What about people who've lived 6, 7, or 8 decades? What about people taking medications, dealing with chronic conditions, or simply wanting to age gracefully without risking their health?
If this is the kind of conversation you've been looking for, please take a moment to hit the like button and subscribe. Your support is what makes these in-depth discussions possible. And don't forget to hit the bell icon so you never miss our next debate. We're building a community where real questions get real answers, not just quick fixes or fear-mongering. Now, let's get into our first big topic.
Let's start with what most doctors and medical organizations are saying about intermittent fasting for seniors. The concerns are serious, and they're based on decades of research about aging, metabolism, and nutrition. First, there's the muscle loss issue. Medical professionals point out that as we age, we naturally lose muscle mass through a process called sarcopenia. They argue that skipping meals, especially breakfast, could accelerate this process. The thinking is that seniors need consistent protein intake throughout the day to maintain muscle mass. When you're fasting for 16 or 18 hours, you're potentially missing crucial opportunities to feed your muscles. Then there's the medication concern. Many seniors take medications that need to be taken with food. Blood pressure medications, diabetes drugs, and arthritis treatments can cause stomach irritation or don't absorb properly on an empty stomach. Medical professionals worry that intermittent fasting could interfere with medication schedules that have been carefully calibrated over years. Blood sugar regulation is another major concern. Healthcare providers often see seniors who struggle with blood sugar swings. They worry that extended fasting periods could cause dangerous drops in blood glucose, especially for people with diabetes or prediabetes. The medical establishment also points to the lack of long-term studies specifically focused on people over 65. But here's where it gets interesting. Many healthcare professionals also acknowledge that the traditional advice of eating every few hours might not be working. Obesity rates among seniors continue to climb, diabetes is epidemic, and many older adults report feeling sluggish and dependent on constant snacking. Some progressive doctors are starting to question whether the standard medical advice has been too conservative. They're looking at emerging research on autophagy, the body's cellular cleanup process that appears to be enhanced during fasting periods. They're also noting that many traditional cultures have practiced forms of intermittent fasting for centuries without the health problems we see in modern societies. The medical establishment is also grappling with the reality that many of their senior patients are already trying intermittent fasting, often without telling their doctors. This has led some healthcare providers to take a more nuanced approach, focusing on how to make fasting safer rather than simply prohibiting it.
Now, let's look at what thousands of seniors are actually experiencing when they try intermittent fasting. These aren't cherry-picked success stories, but patterns emerging from real people's experiences. Many seniors report that intermittent fasting actually simplified their medication routines. Instead of trying to time multiple medications around frequent meals, they found it easier to take morning medications with their first meal and evening medications with their last meal. Some discovered that certain medications worked better when they weren't constantly processing food. Energy levels are consistently mentioned in senior testimonials. Contrary to medical fears about weakness and fatigue, many older adults report feeling more energetic during fasting periods. They describe a mental clarity that they hadn't experienced in years. Some say they sleep better and wake up more refreshed. Weight management is another common theme. Seniors who had struggled with weight gain despite following traditional dietary advice found that intermittent fasting helped them lose weight without feeling constantly hungry or deprived. Many report that the weight loss was gradual and sustainable, unlike crash diets they'd tried before. Interestingly, many seniors found that intermittent fasting improved their relationship with food. Instead of mindless snacking throughout the day, they became more intentional about their meals. They reported enjoying their food more and feeling more satisfied with smaller portions. Blood work improvements are frequently mentioned. Seniors report better cholesterol numbers, improved blood sugar levels, and reduced inflammation markers. Some were able to reduce medications with their doctor's supervision. But the experiences aren't universally positive. Some seniors tried intermittent fasting and found it didn't work for their lifestyle or health conditions. Others experienced the exact problems doctors warn about: initial fatigue, dizziness, or difficulty managing their medications. The pattern that emerges is that success often depends on the approach. Seniors who jumped into extreme fasting schedules often struggled, while those who gradually extended their natural overnight fast found it more manageable. Many successful senior fasters emphasize the importance of working with healthcare providers who are open to monitoring their progress rather than dismissing their choices. Social factors also play a role. Some seniors found that fasting interfered with social meals or family traditions. Others discovered that it actually freed them from the pressure to eat at social gatherings when they weren't hungry.
There are several aspects of intermittent fasting that rarely make it into mainstream discussions, but they're particularly relevant for seniors. First, there's the autophagy factor. This is your body's cellular housekeeping process, where damaged proteins and organelles are broken down and recycled. Research suggests that autophagy increases during fasting periods, and this might be especially important as we age. Think of it as your body's way of taking out the cellular trash that accumulates over time. Some researchers believe that enhanced autophagy could play a role in preventing age-related diseases like Alzheimer's, Parkinson's, and certain cancers. While the research is still emerging, the possibility that intermittent fasting could support brain health is particularly intriguing for seniors concerned about cognitive decline. There's also the insulin sensitivity aspect. Many seniors develop insulin resistance over time, which can lead to type 2 diabetes and weight gain. Some studies suggest that intermittent fasting can improve insulin sensitivity, potentially helping seniors maintain better blood sugar control with less medication. The inflammation connection is another hidden benefit. Chronic low-grade inflammation is associated with many age-related health problems. Some research indicates that intermittent fasting might reduce inflammatory markers in the blood. If this proves true in long-term studies, it could have implications for everything from arthritis to heart disease. Mental health benefits are also reported but rarely discussed in medical settings. Many seniors describe feeling more in control of their eating, less anxious about food choices, and more confident in their ability to manage their health. Some report that the structure of intermittent fasting helps them feel more organized and purposeful about their daily routines. The economic aspect is worth considering too. Seniors on fixed incomes sometimes find that eating fewer meals reduces their grocery bills without compromising nutrition, especially if they focus on nutrient-dense foods during their eating windows. But here's what many advocates don't discuss openly. The adaptation period can be challenging for seniors. Unlike younger people who might bounce back quickly from the initial discomfort of changing eating patterns, seniors may need weeks or even months to fully adapt. The body's stress response systems may be less flexible, making the transition more difficult.
There's also the social isolation risk. Many senior social activities revolve around food, and rigid fasting schedules can interfere with these important social connections. For seniors who are already at risk of social isolation, this could be a significant downside. The digestive system changes that come with aging can also complicate intermittent fasting. Seniors may have slower digestion, reduced stomach acid production, or other gastrointestinal issues that make large meals within short eating windows uncomfortable or problematic.
Let's address the risks that are real and specific to seniors, not just theoretical concerns, but actual problems that have been documented. Medication interactions are a genuine concern, but not in the way most people think. It's not just about taking pills on an empty stomach. Some medications have what's called a narrow therapeutic window, meaning the difference between an effective dose and a dangerous dose is small. Changes in eating patterns can affect how these medications are absorbed and metabolized, potentially making them less effective or more toxic. For example, blood thinners like warfarin can be affected by changes in vitamin K intake, which might fluctuate when meal timing changes dramatically. Diabetes medications, designed around specific meal schedules, can cause dangerous blood sugar swings if not adjusted for fasting periods. Dehydration is another serious risk that's often overlooked. Seniors already have a reduced sense of thirst and may not drink enough water during fasting periods. When combined with certain medications like diuretics, this can lead to dangerous dehydration, kidney problems, or dangerous electrolyte imbalances. The gallbladder issue is particularly relevant for seniors. Extended periods without food can increase the risk of gallstone formation, especially in people who already have a history of gallbladder problems. For seniors who've had gallbladder surgery or have existing gallbladder issues, intermittent fasting might not be appropriate. Bone health is a concern that deserves more attention. Some research suggests that extreme calorie restriction or irregular eating patterns might affect bone density, which is already a concern for many seniors, especially postmenopausal women. There's also the eating disorder risk, which people don't often associate with seniors. Older adults who develop rigid rules around eating, become obsessed with fasting schedules, or use fasting to mask depression or anxiety about aging, may be developing unhealthy relationships with food that could worsen their overall health. The immune system impact is still being studied, but some research suggests that prolonged fasting periods might temporarily suppress immune function. For seniors who already have age-related immune system changes, this could potentially increase susceptibility to infections. Falls risk is another practical concern. If intermittent fasting causes dizziness, weakness, or blood sugar fluctuations, it could increase the risk of falls, which are already a major health concern for seniors. But perhaps the most significant risk is the one-size-fits-all approach. What works for a healthy 65-year-old might be dangerous for an 80-year-old with multiple health conditions. The internet is full of success stories, but it's also full of advice that doesn't account for the complexity of senior health.
So, where does this leave us? The truth is, intermittent fasting for seniors isn't a simple yes or no question. It's a complex issue that depends on individual health status, medications, lifestyle, and goals. Some healthcare providers are developing what they call senior-friendly approaches to intermittent fasting. These typically involve shorter fasting periods, more gradual transitions, and closer medical supervision. Instead of jumping into 16-hour fasts, they might suggest starting with 12-hour overnight fasts and slowly extending them if tolerated. The modified approach often includes what's called dirty fasting, where small amounts of calories are allowed during fasting periods to help with medication timing or blood sugar stability. While purists argue this isn't true fasting, it may be a safer option for seniors with complex health needs. Regular monitoring becomes crucial for seniors who choose to try intermittent fasting. This might include more frequent blood work, blood pressure checks, and medication reviews.
Some doctors are creating specific protocols for senior patients who want to explore fasting safely. The timing approach is also different for seniors. Instead of following strict clock-based schedules, some seniors find success with flexible fasting that adapts to their social schedules, medication needs, and energy levels. This might mean fasting on some days but not others, or adjusting fasting windows based on planned activities. Many successful senior fasters emphasize the importance of focusing on food quality during eating windows. With fewer meals, each meal becomes more important for meeting nutritional needs. This often means prioritizing protein for muscle maintenance, calcium for bone health, and nutrient-dense foods over empty calories. The community aspect has also proven important. Seniors who have support from family, friends, or online communities tend to have better experiences with intermittent fasting than those who go it alone. Having people to share experiences with, ask questions, and provide accountability can make the difference between success and struggle.
If you're considering intermittent fasting, here are the specific questions you should ask your healthcare provider. Don't just ask, "Can I try intermittent fasting?" Instead, get specific. Ask about your medications. Which ones need to be taken with food? Which ones could be affected by changes in meal timing? Are there any that would make fasting dangerous for you specifically? Discuss your health conditions. If you have diabetes, heart disease, kidney problems, or any chronic condition, how might intermittent fasting affect your management plan? Are there warning signs you should watch for? Talk about monitoring. What blood work should be done before starting? How often should you check in? What symptoms would indicate you should stop immediately? Ask about your specific nutritional needs. Do you have higher protein requirements? Are you at risk for any nutrient deficiencies? How can you ensure you're meeting your nutritional needs in a shorter eating window? Discuss alternatives. If traditional intermittent fasting isn't appropriate for you, are there modified approaches that might provide some benefits with less risk? Don't forget to ask about the social and psychological aspects. How important are regular meal patterns for your mental health? Do you have a history of eating disorders or unhealthy relationships with food?
Here's the truth. There is no universal answer to whether intermittent fasting is right for seniors. The medical establishment's concerns are valid, based on real risks and the complexity of aging bodies. But the experiences of thousands of seniors who found benefits are also valid and can't be dismissed. What we can say is this: intermittent fasting for seniors requires a more nuanced, careful approach than it does for younger people. It requires medical supervision, gradual implementation, and constant attention to how your body responds. The goal of this channel isn't to tell you what to do. It's to give you the information and questions you need to have meaningful conversations with your healthcare providers. It's to help you become an informed advocate for your own health, whether that means trying intermittent fasting with proper precautions or deciding it's not right for you. Remember, the best diet for you is the one you can follow safely and sustainably while maintaining your quality of life and social connections. For some seniors, that might include intermittent fasting. For others, it might mean sticking with traditional eating patterns while making other healthy changes. What matters most is that you make informed decisions based on your individual circumstances, not on fear or hype from either side of the debate. If you found this discussion helpful, please like this video and subscribe for more honest conversations about senior health. Next week, we're diving into another controversial topic. Are multivitamins a waste of money for seniors or essential insurance for aging bodies? It's another debate where both sides have compelling arguments, and we'll examine them all. What questions do you still have about intermittent fasting? Share them in the comments below, and remember to tell us which side of this debate you find more convincing and why. Your experiences and questions help shape future discussions. Until next time, stay curious, stay informed, and most importantly, stay healthy.